At a time when unemployment is at a 25-year high and with a federal deficit breaking the $12 trillion mark, the House of Representatives passed a health care bill that raises taxes more than $700 billion. And this is, Mr. President, the House-passed health care bill here on this desk. I expect the Senate version of that, which may be produced today, will be of a similar size. Who gets taxed under the House-passed bill? Well, let's take a look at it. At the top of the list is a small business who gets taxed under the House-passed bill. Small business, we'll start there. A small business surtax in the bill, that takes $150 billion out of our job creators. Now that is on page 344 of this massive 2,000-page House bill. On page 344, $150 billion surtax on small business. And we all know that small business is the biggest job generator in our country. They employ well over half of those who have employment in our country. Second, this is a bit hard to reach, Mr. President, it's a little bit far back. Second, we have an employer tax. The employer tax raises $135 billion in taxes through a new mandate on employers. Now that's on page 281 of this massive 2,000-page bill. Now the NFIB, National Federation of Independent Business, which represents small business, estimates that mandate would cost about 1.6 million jobs. Now that's a $1.6 million job-killing tax at a time when the national unemployment rate is 10.2%. The insured, the third group of people who will be taxed here, insured Americans, item number 4 here. Let's look at the tax on insured Americans. Billions in new taxes to pay for comparative effectiveness research rationing in this 2,000-page bill. It's on page 1,179. A tax on those who are insured, Mr. President. And then we have a tax on those who are uninsured. Item 3 here, uninsured Americans. They get taxed as well, a 2.5% income tax on the uninsured. And that, Mr. President, is on page 303 of this roughly 2,000-page bill. Medical devices, upon which those who are sick depend heavily. Medical devices will also be taxed. People needing life-saving medical devices will also receive a tax increase on page 347 of this massive 2,000-page bill. There'll be a $20 billion tax on medical devices. And of course, Mr. President, they'll be passed straight on to the consumers. So that will, in effect, be a tax on those Americans who are sick and who need medical devices. There's also, Mr. President, a tax on the chronically ill. Item number 4 here, the chronically ill. On page 332 of this 2,000-page effort to restructure the American healthcare system, you find flexible spending accounts would be capped at $2,500 and phased out over time. Now, how does that affect the chronically ill? As a result, tens of millions of families, many of whom are managing chronic illnesses, will see billions in tax-saving benefits from these FSAs wiped out, right here on page 332 of this 2,000-page bill. What does all this mean to small business, Mr. President? David Bolin is the manager at Bolin Maloney Lumber in Louisville. He wrote to my office to say what it means. He said, healthcare reform that does nothing to control costs, and we already know from CBO and from the actuary at the Health and Human Services that the bill doesn't control costs. It does nothing to control costs, but merely increases the burden on small businesses through mandates and tax hikes is a dangerous and risky proposition that will imperil my company and our national recovery. So, Mr. President, don't take it from me. Listen to David Bolin. He gets it. He knows that slashing Medicare, increasing premiums, and raising taxes in a recession is not reform. There was actually, Mr. President, a front-page story on the Washington Post this very morning, about a company in Louisville that kind of underscores what I'm talking about. The front-page story in today's Washington Post describes the ongoing struggles of a small manufacturer in my hometown of Louisville who's fighting to save jobs. This business owner wants to be more productive so that he can hold on to his workers, but all of these crushing taxes, many of which would apply to his company, are simply not going to be helpful. Finally, Mr. President, yesterday I spoke about the Medicare cuts, the massive Medicare cuts in this bill that we're shortly going to be considering. It's important to remember Senate Democrats recently tried to pass a so-called doc fix that would have forced seniors to pay higher premiums on top of $500 billion they want to cut from Medicare. Fortunately, this bill was rejected by a wide bipartisan majority. While we all think this problem needs to be addressed, this is not the way to do it. And I'm confident that should a similar bill pass the House later this week, we'll reject it again on a bipartisan basis. Mr. President, I yield the floor.
Under the previous order, the leadership time is